What is diabetes? Diabetes is a condition that causes sugar in the form of glucose to accumulate in the blood, rather than being used as fuel by the body cells. When we eat, our digestive system breaks food down into nutrients, which are then absorbed to be used in our bodies. Carbohydrate-containing foods like starches and sugars are broken down into glucose. Glucose is an important source of fuel in our bodies. To be used for fuel, glucose must enter our cells. The pancreas releases a hormone called insulin, which signals cells to allow glucose to enter. After a meal, blood glucose levels rise. Insulin is released into the bloodstream and triggers cells to open their glucose channels to allow glucose to enter and be converted into energy. In type 2 diabetes, the cells become resistant to insulin and ignore its signal to absorb glucose from the blood. This is known as insulin resistance. In type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger resistant cells to absorb glucose, and becomes worn out over time. The most common symptoms of diabetes are frequent urination and excessive thirst. And other symptoms include weakness, drowsiness, and blurred vision. Over time, high blood glucose damages the blood vessels and the organs that these supply. Microvascular damage, or damage to the small blood vessels, causes vision problems including blindness, nerve damage, and kidney damage. Macrovascular or large blood vessel damage can lead to cardiovascular complications like heart disease, strokes, and poor circulation, resulting in slow wound healing and even amputations. Overweight and inactivity are major causes of type 2 diabetes. A family history increases your risk of developing the disease. Certain ethnic populations are also at increased risk. Finally, some medications may increase your diabetes risk. These include corticosteroids, thiazide diuretics or water tablets, some drugs used to treat mental illnesses, and some antiretroviral drugs.